Lisa. How are you?
Good, how are you?
I'm good.
Good.
So, please tell us about yourself and also some details regarding your disease, your fistula.
I am 35 years old. I'm from Texas, from USA, and I apparently had a level 5 complex fistula, as well as a hemorrhoid, as well as 2 abscesses, and as well as an external fissure, correct?
Yes.
I think that covers all of it.
Yes. So, anything about the past journey regarding your previous surgical procedures, wherein any procedures which were done in the past, and also your experience regarding the previous surgeries?
I have never had this much trust in doctors before in my life, before coming to India. I just felt like it was the right thing to do because all of my previous doctors, I had 2 specialists in Dallas, Texas, which is north of where I am. I had a team of doctors at MD Anderson Cancer Center, which is, one of the most top hospitals for cancer treatment in the world. And on top of that, I had a general physician in Austin. My first surgery was with the general physician in Austin. He placed 2 setons because he noticed abscesses right away, and he didn't know about the fistula at the time, and he even said that my case was a level 10 and he was a level 5. So unfortunately, I'll be looking at a malpractice lawsuit whenever I get back. But in regards to further treatment, luckily I'd already scheduled an appointment at MD Anderson with my doctors there to see, what they could do. And they placed a drainage tube as well as replaced the 2 setons. And then she even told me that my case was worse than she had ever imagined and had experience with, and so she recommended 2 specialists in Dallas. So I saw them, and they told me that the only treatment for my case was to get another colostomy bag, and I just knew that wasn't it.
So, how are you feeling now? Because you no more have a colostomy bag, and then your fistula is also healed. So how do you feel about it?
Yeah, everything is not there anymore, except a couple of cavities left over to heal. But I feel much better. I can actually sit on 2 butt cheeks almost completely comfortably. I can walk around without being in extreme pain. I can eat almost all the foods that I like, except I still have to be careful with fried foods. Being a Texas girl. And the treatment here has just been wonderful and overall a great experience, and very caring and very kind and gentle and generous.
Thank you. Also, anything you would add on regarding the journey throughout the fistula recovery, including the news of your pregnancy and then how you dealt with it? Like, anything to add on that?
Yeah, so it was quite shocking news. As you know, it was I was waking up from anesthesia, I think after my second EUA.
Yes.
And you already have big, beautiful brown eyes, and they were even bigger whenever you were telling me the news. Plus, your smile was huge and white, and then all the doctors behind you were smiling really big, and the room was dark, and I was like, this is really creepy. And then you're like, congratulations, you're having a baby, and I'm like, wait, let me wake up from anesthesia first. Hold on, let's try this again. And so sure enough, obviously you have no reason to give any false news about anything, and
Yes.
so I was shocked, but it's been a blessing because my first surgeries, whenever I had a colostomy bag 12 years ago, they told me that it created so much scar tissue around my ovaries that it would decrease my fertility rate by 60%.
Yes.
So I used to not think that I could even get pregnant, and I've always wanted to be a mom, and I've always loved kids. I've never had an issue with that, so it's been a blessing and exciting and loving. So,
Yeah, because me myself being a part of your journey throughout your every evaluation, and since day 1 when you got operated, regarding the drug doses, regarding the anesthesia, we tried keeping things on point so that the baby is also safe, and touch wood, fortunately the scans are also all normal, baby's doing good, baby's healthy, so we are really happy for it.
Yes, I'm very thankful for that, given all my medical history over the course of, I guess, in February 2024 will be 13 years,
Yes.
given everything. And even whenever I saw the gynecologist here, whenever Dr. Porwal set up that appointment with Dr. Naya, I can't remember her actual
Yes,
practice
Dr.
name, yeah, but she was awesome and really caring as well, really knowledgeable and informative. Of course, I don't know the sex yet, but but yeah, it was overall a great experience and very helpful by Dr. Porwal as well to do that for me.
Thank you.
Yeah, thank you.
Anything else you would like to add, or anything specific you would like to mention, which was like a turning point, or say a thing which you'll remember throughout some event or something in the complete fistula healing journey? Anything you would like to add?
I guess just for future patients, they should really, any patient should always listen to a doctor, and it's been hard for me because westernized doctors don't really care about post-treatment, and they don't really care, in my opinion, to be real doctors, to be true caregivers and post-caregivers. There's something else, the vitamin C, I think it was.
Yes.
Just take all of it and stay hydrated and eat healthy and stay away from fried foods and greasy foods and eat lots of vegetables and fruit and no spicy foods. If you can handle it normally, that'd be cool. But for me, I couldn't. And then obviously get plenty of rest as well.
Exactly. I
Yeah.
would say.
Yeah.
Also, anything to add on regarding the post-operative care? How your journey went? Did you find it smooth?
Yeah.
What all things? Like anything you would add on that?
Yeah, I think everything went smooth. Again, it's all about listening to the doctors, and also not only that, but as a patient, providing our feedback.
Exactly.
Because
Notifying
it
things on
takes,
time.
yeah, and I obviously had no problems with communicating that with you,
Yes.
and I've never have before with my other doctors back home, and yeah, it's all about communication and working together. Even though this is your profession, I've never tried to tell you how to do your job, and I don't want you to tell me how to do my job.
Yes.
But at the same time, everybody is different, and so you deal with so many patients, and so you're constantly having to navigate different levels or extremes of situations. And so yeah, just communicate, with your doctors and your nurses
Exactly.
what
So
you need.
as a surgeon myself, that really helped us a lot, because you would always notify even the small updates or anything unusual, or say even the normal things were always updated.
Mhm.
So whenever you put forward a story, it just gets better for us to deal with the problems, or say if there are no problems, it's actually easier for us to counsel you and take you a step ahead towards your healing process.
Exactly. Yeah. Yeah. Awesome.
Alright then.
Thank you,
Thank you
Godmother.
very much. Thank you.